talking. Mr. Riyad Matthew, Editor of the Week, Honorable Member of Parliament, very senior MP and ex-Union Minister, Dr. Shashi Tharoorji, Director, All India Institute of Medical Sciences, Dr. Srinivas, and Head of the ICRC, Shri Kadir Omar, esteemed guests, delegates, and the entire team of the week who's been engaged, I guess, for many days to host this event. All my dear friends, it's an absolute pleasure and privilege for me to be here before this very, very august and accomplished audience who's united by a shared commitment to a cause that touches the life of each one of us, every individual, every family, the whole community and the whole world, and that is healthcare. So I would like to, at the outset, commend the efforts that have been undertaken by the organizers, the week, for bringing so many of the experts, the best of minds in the healthcare together on one single platform to initiate a very engaging one-day-long dialogue through different technical sessions on varied subjects in an effort to create a healthy India. So big, big congratulations. I am also happy to learn of the week's pioneering role in health reporting. And I think Mr. Riyad Matthew said it very rightly, that we may be jack of all trades, but what we enjoy the most is reporting about health. So I do appreciate that role that the week plays regularly. And it's also interesting to learn that the annual rankings of India's best hospitals that you bring about is also much awaited in the industry. So once again, my heartfelt greetings to each and every person who's worked very hard to make this conclave happen here today. And my gratitude for inviting me here to share Government of India's perspective on what we are doing, we have done in the past 2 tenures, and what we will be doing in this 3rd tenure, as Honorable Prime Minister of India has promised to this nation that we'll be working 3 times the speed in the 3rd tenure and try our level best to create a healthy India, a developed India. So thank you very much for having me here. I would like to give an overview of how the Ministry of Health and Family Welfare is moving ahead. We're guided by the National Health Policy 2017, which is committed to the attainment of the highest possible levels of health and well-being for each and every individual. How? Through a promotive and preventive orientation of healthcare in all our developmental policies, programs, schemes, by ensuring universal health coverage, and also to make sure that no single person has any financial hardships to face for the same. That is, to gain accessible, affordable, and quality healthcare. And keeping in view the goals of the National Health Policy 2017, we launched our flagship program, which is called Ayushman Bharat. Ayushman Bharat rests on 4 pillars, which takes care of primary, secondary, and tertiary aspects of healthcare. The first pillar being the Ayushman Arog Mandir, under which we have made a paradigm shift. How? Because earlier our approach to health used to be very sectoral and selective. But with the Ayushman Arogya Mandirs being created, our approach to health is holistic and comprehensive. which addresses through a preventive, promotive, curative, palliative and rehabilitative orientation by providing an expanded range of services. So now there is a package of 13 different services which is provided at the most basic level, which is the primary health facilities. And these are the Ayushman Arogya Mandir, which has approximately 1,74,000 in number. And recently, as part of our 100 days agenda, which the government had announced, we launched the NQAS certification drive for all these Ayushman Arogya Mandir, which is the National Quality Assurance Standards certification. Because we want that the minimum benchmarks of quality healthcare must be met at the level of the provision of primary healthcare facilities to each and every citizen of the country. The second and the most second important pillar being the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which you are aware of. It's one of the most important, biggest health assurance schemes globally, which covers 40%, the bottom 40% of our population who do not have access to good quality secondary and tertiary health care. So there are 12.74 crore beneficiary families who have been covered. Of course, in the month of February this year, we included our ASHAs and ANMs, so the frontline health workers also. But the biggest news is, as the person who was anchoring the event also said, that the senior citizens are very happy because my government, again as part of its 100 days agenda, and also to fulfill the promise made by the Prime Minister before Lok Sabha elections, we have expanded this Pradhan Mantri Jan Arogya Yojana health insurance cover of rupees 5 lakh to the senior citizens of this country who are aged 70 and above. We do recognize that the senior citizens of this country are the most vulnerable group, the most needy group, and especially when the life expectancy of India has increased and we have a significant number of our elderly population, and also the trend that we have in our society that's taking us towards nuclear families, these elderly citizens are left without any support. So here we are, the Government of India and my ministry, which has lent its hand forward to support these senior citizens and provide them an insurance cover of 5 lakh rupee. And by way of this decision that Government of India and my ministry has made, we are extending this facility to 6 crore elderly population from 4.5 crore beneficiary families. The third most important pillar being the Ayushman Bharat Digital Mission. We cannot work without a integrated digital health infrastructure, but that needs a backbone which is going to be provided by the Ayushman Bharat Digital Mission. And this is an initiative which will correct the existing gaps between the different stakeholders of health through digital highways. And we are moving very fast with this initiative of Ayushman Bharat Digital Mission, creating more and more Aadhaar unique identities and generating Aadhaar numbers and creating the Aadhaar-linked health records. And the very recent initiative that has been taken under Ayushman Bharat Digital Mission has been the launch of the NMR portal, the National Medical Register portal. Under this mission has also been launched as part of our 100 days agenda, and this will be a centralized repository, a central database of all the registered medical practitioners in modern medicines across the country. So you can see how fast we are marching towards the goal of creating a healthier nation. The fourth most important pillar, my dear friend, which is often talked about, is upgrading our health infrastructure. And I would like to begin by saying that COVID-19 pandemic, when it struck the whole world and India, it demonstrated the deficiencies within our healthcare infrastructure, and it told us that the health system of India needs strengthening. Not just to develop the capacity of responding timely and appropriately to any future outbreak or pandemic, but also ensuring that the essential medical services during the non-pandemic situations are not compromised. And that's when we came up with this idea of the Ayushman Bharat Prime Minister Health Infrastructure Mission, which is aimed at correcting those deficiencies or gaps, critical gaps which exist in our primary, secondary and tertiary level healthcare facilities, developing their capacities, strengthening them, making our national level institutions better and creating newer institutions so we could respond to and deal with the newer and emerging diseases and infections. Over the past 10 years, there has been a massive scale-up of health infrastructure. And that can be seen in the increase in the number of the primary and secondary level health facilities, which means you begin from a sub-health center to a PHC, to a CHC, to a sub-district hospital, to a district hospital. There has been a significant increase, and that has been possible because of the consistent and concerted efforts of the Government of India. But apart from creating these, enhancing the number of these secondary and primary healthcare facilities, we've also focused on creating a better tertiary healthcare delivery system, and which is why we decided to correct the regional imbalances in the availability of quality tertiary healthcare facilities, and also at the same time augment the quality medical education infrastructure. So we took two major steps. One is that we enhanced the number of All India Institute of Medical Sciences so that the burden on the All India Institute of Medical Sciences that is headed by Dr. Srinivas goes down. So people have All India Institute of Medical Sciences in their own states, and we built many of them, 22, many more will come. Also, the government medical colleges which were existing have been upgraded. And the second part, which is about the creation of new medical colleges across the country, so 157 new medical colleges have been constructed. There has been a 101% increase in the number of medical colleges. How? Prior to 2014, we had 387 medical colleges. I proudly say that now in past 10 years of our work, India has 779 in the year 2024. This has led to an increase in not only the PG seats but also the UG seats. So there has been a 127% increase in the UG seats and 135% increase in the PG seats. And additionally, we don't stop here. Yes, we are happy, we are delighted, we're proud of our achievement, but that's not all. We intend to do more. And you may have heard Prime Minister Modi say that we are going to create 75,000 additional UG and PG seats in the next 5 years of our government. How we are doing? That is a matter of discussion. There are several possibilities which are being explored. We have to operationalize the 27 medical colleges out of the 157 which are not yet functional. We are prioritizing the remote and the rural areas, the far-to-reach areas, for building up new medical colleges associated with the district hospitals. There are still few district hospitals left associated with which we can build more medical colleges. Or we can also consider our large hospitals of the other central government ministries, and we can build up medical colleges, we can utilize those beds. But there are several ways. We're still pondering, we're still exploring. But 75,000 new UG and PG seats would be created by Government India in the third tenure, and that is why I say we are working with 3 times our speed in the third tenure. Moving on from the infrastructure, what's important for us is the availability of drugs, diagnostics, for which we rolled out the free drugs and essential diagnostic initiative. And from the sub-center to the PHC, CHC and district hospitals, there are certain specified number of essential drugs and diagnostic services which are being provided, made available to the citizens free of cost. And to strengthen this at the higher level, we also came up with the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana. And I very proudly say that this initiative, which was aimed at providing quality as well as affordable generic drugs to our citizens, we had a meager number of 80 Jan Aushadhi Kendras in the country in 2014. From there, it's a long journey. We have moved on to creating 13,000 Jan Aushadhi stores in the country today in 2024. And once again, we don't stop here. Prime Minister says we have to create 25,000, which means in the next 3 years, additional 12,000 facilities would be created, Jan Aushadhi stores. 12,000 more would be created in the next 3 years, and these have led to crores and crores of savings of the general population, more than 30,000 crores in the past 10 years. And why has this initiative been taken? Because there is a much debated issue of the out-of-pocket expenses. When I spoke about the Ayushman Arogya Mandir providing the primary health care or secondary health care, that in a way is contributing to cutting down on the out-of-pocket expenses. But the initiatives of the free drugs, free diagnostics, Jan Aushadhi have also led to reducing the out-of-pocket expenses, which again, I am pleased to state that it used to be 63% as a share of total health expenditure. OOPE used to be 63% in the year 2014-15, which went down to 2019-20, it went down to 47% in 2019-20, and it is further down to 39.4% in the year 2024 when we meet for this conclave. This is no mean feat, my dear friends, and it shows that Government of India's efforts have alleviated the financial burden on millions of households in this country. We're also promoting research and development healthcare, and now there is an increased funding for biomedical research. We are forging collaborations between the public health institutions as well as the private companies in order to accelerate the breakthroughs. There are also collaborations being forged, global health partnerships being made. Why? Because such partnerships will actually foster advancement in medical research as well as health technology and help us to find global healthcare solutions. We're also promoting innovations in a big way, whether in vaccines or diagnostics or treatments. And I would like to quote here an example of telemedicine services. The way they have been expanded, they're now allowing us to reach the most inaccessible, remote and far-flung areas and making the teleconsultation for such population easier and possible. Country is also benefiting from the health tech startups which are coming up, and these are supported by the Government of India as well. Investments are also being made in the education and training of our healthcare workforce, and that is an initiative which is instrumental in making them more skilled, updated with the latest mechanisms to address not just the domestic but the global healthcare challenges as well. So friends, there is so much that my ministry and Government of India has done, is doing, plans to do, but that cannot be summed up in the limited time that I have. All I want to say is that we understand that health is the foundation of our growth. And only a healthy population can lead to a thriving nation. And Prime Minister of India says that when our people are healthy, we can achieve greatness as a nation and we can achieve greatness as the world. So we at Government of India today are guided by the philosophy of Antodaya, which is leaving no one behind, which is why we talk about universal health coverage. And at the same time also Vasudhaiva Kutumbakam. And the biggest example of this could be the way we supplied essential medicines and vaccines to more than 150 countries in the world during the COVID pandemic times. India is now known as the pharmacy of the world. So much of generic medicines, drugs are being supplied by India, vaccines, everything. And too many advancements are being made. So these are the two philosophies guiding us, and we are marching fast towards our goal, which is of creating a healthier nation, which is of creating a developed nation, as India completes 100 years of its independence, we dream, we envision to be a Viksit Bharat. But as we move towards this journey of growth and prosperity of India, we don't want to walk alone. We want each one of you to join hands with Government of India, and together we can create a healthy India, a Viksit Bharat. With this, I once again thank the week for inviting me, and I thank all of you for your attention and your patience. Thank you very much once again. Jai Hind.